Welcome, everyone, to Gift of Health Total Wellness. And I'm so excited to welcome you all. For those of you who are meeting me for the first time, I'm Dr. Shobha Rayapudi. I'm a lifestyle medicine doctor and co-founder of Gift of Health. At Gift of Health, we help people struggling with chronic diseases, including but not limited to high blood pressure, high cholesterol, heart disease, arthritis, gut diseases, common conditions that you see nowadays. So we help them to break free from those diseases, reduce their dependency on medications, and have more energy. So we are so excited that you're here, and today's session, you are going to love it because I have a special guest, and I hear this all the time. Like, okay, as women, how can we take care of ourselves? Especially, especially like we as women, when midlife hits us, right? It is inevitable for us to experience decline in our hormones. And so that's why I have a special guest today who is an endocrinologist. So just allow me to introduce you to our special guest. So I have Dr. Rajasree Nambron, who is a highly accomplished physician and educator in the field of endocrinology. So she holds multiple board certifications. So she is certified in internal medicine, endocrinology, diabetes, metabolism, lifestyle medicine, and obesity medicine, and is also a certified coach. She works at the underserved clinics of University of Texas, Houston, and she tries to incorporate the pillars of lifestyle medicine for her patients with diabetes, obesity, and mostly like women in their midlife. So she also earned her MBA degree in healthcare administrations from University of Massachusetts Amherst, and with a strong commitment to clinical excellence, she also completed her clinical fellowship in diabetes and endocrinology in United States. So without further ado, I would like to welcome her. So before she steps in, I just like wanted to point to all the viewers here. So like as you can see, and you all might agree with this, like in women's body, estrogen is the master hormone, right? I mean, it's the giver of life. It controls everything. It controls metabolism, our immune function, digestion, cardiovascular performance, mood, brain health, you name it. So how can we make it our midlife most vibrant and most fulfilling years of our life when it is during that time that this critical hormone is going down? Like, are there things that we can do today that will set the stage for many years of vibrant postmenopausal health to come? Or can we eliminate debilitating symptoms like hot flashes or brain fog or anxiety or muscle or joint pain that we see with menopause? So Dr. Rajasree is here to answer all those lingering questions that you have. And make sure, so if you have questions, just type in the chat and I'll be sure to ask Dr. Rajasree, okay? So with that, welcome, Dr. Rajasree, and I am so honored and thank you so much for making the time to join us today.
Thank you so much, Dr. Shobha, for inviting me for this talk with Gift of Health. So I am also going through this midlife. So are many of my patients who I take care of. So that's why the whole interest in midlife women's health came about. Me being an adult endocrinologist, usually in our endocrinology fellowship or in our medical school, not much is talked about or educated about during this life stage. It's just, we are just asked that it is just a normal aging process and to get through with it. But things are changing now. So that's why I've made this presentation for how we can use lifestyle medicine pillars in women's health in midlife.
Yes, so go ahead and share, Rajshri. Okay, so we are able to see your screen. Then to get through with it.
All right, so let's start. So our main objective today is to create awareness about, like I said, the role of lifestyle medicine in how we as women deal with perimenopause, menopause, and one of the other um, process that I deal with in my patients is polycystic ovarian syndrome. So try to talk about the potential impact of lifestyle choices, discuss the lifestyle interventions and some practical strategies that I use for my patients as handouts and resources that can help incorporate the lifestyle changes in their daily routine. So I'll start with a case that usually it's a common office presentation that I get in my clinic. A 51-year-old Hispanic woman comes to my office for uncontrolled diabetes, and her past medical history includes obesity, hyperlipidemia, previous history of cholecystectomy. So major concern on that visit was poor sleep because of night sweats. And that also led to her elevated blood sugars overnight. And it happens about 2 to 3 times a week overnight. So her last menstrual period was 5 years ago. So as usual in my office, because of the lifestyle pillars that I practice, and I want my patients to practice, I take a thorough diet history. So it led to me identifying that there is some processed starchy foods that she takes, and so does. Her vitals at that visit was BMI of 37, blood pressure 140 over 80 millimeters of mercury, and heart rate 88 per minute. The exam findings were relevant for obesity and acanthosis around her neck. At that point, her medications were glimepiride 4 milligrams daily and metformin 1,000 milligrams twice a day. For knowledge sake, I've pasted her hemoglobin A1C when she first came to see me in 2021 and how it has improved over the course of time. She still continues to see me. And this was her kidney and liver test. At that time, you can see how her ALT was elevated as well in the first visit. So with that background, I would like to explain what perimenopause is. It is a stage in menopause transition that is characterized by irregular menstrual cycles. It can last for 1 to 3 years, and women tend to have symptoms related to declining estrogen levels. Now, menopause is that transitional event where the patient or the woman has had the final menstrual period and had no period for the last 1 year. That then we call it menopause transition has been done, and after that it is post-menopause. So it represents a permanent cessation of menses resulting from loss of ovarian follicular function, mainly because of aging. There can be a surgical or iatrogenic loss of ovarian function as well, and leading to cessation of periods. Median age in women in the United States is 52.5 years. Nowadays, worldwide, women live longer, and was surprising for me to find that many women will spend more than 40% of their life in post-menopause, and also more than 60% of women survive at least until 80 years.
That is so true, Rajshri. Like, imagine like 40% of our life, if we are spending it here, isn't it important that we know like how to survive this phase and what we can do? So,
Definitely.
yeah, thank you so much.
So one of the pioneering study was the study of women's health across the nation's one study, which actually started out in 1994, and they've been recruiting patients 96, and also it's in the 6th round of funding now. It's an ongoing study, and it is one of the largest multiracial ethnic longitudinal cohort study. It's an observational study for women in ages 40 to 65 years of age. And this has contributed to our understanding of the impacts of menopause transition versus midlife aging on women's health and their social, biopsychosocial components as well. Also wanted to just point out that during this time, the progesterone goes down steeper than the estrogen. So the symptoms of menopause or menopause transition happens because of this change in estrogen levels, in that there is a relative estrogen increase because the progesterone has 75% reduction in that 35 to 50 years. So that's why you get these symptoms of mastalgia and feeling of brain fog and things like that. And this is again seen in the SWAN study. I just took this picture from the SWAN study article, again telling you how many stages of reproduction does a woman go through, and there is a menopausal transition, post-menopause, and that perimenopause during the late stages when the vasomotor symptoms are likely to happen. And you can see how the hormone level changes here. There is a relative increase in variability of FSH, and then later on the FSH climbs up and it stabilizes by the time the women leads to menopause. And you can see how the AMH and inhibin are low, and the antral follicle counts are also very low during this time as the transition goes along. In
So,
post
yeah, so Rajshri, like since we got a question, I thought it was just apt to ask here rather than waiting till the end. So you just mentioned that estrogen level is high, like compared to progesterone, and that might lead to symptoms of mastalgia or brain fog. So here they're asking, does increased estrogen cause brain fog?
Yes, so basically if you see here, there is a relative, there is decline. See, if you see the graph, there is a decline in estrogen. So when you were before perimenopause, you had a higher, the estrogen and progesterone were not declining like this. It was, in the same, the green part of the graph. Now, what happens is with aging, the estrogen also declines. So imagine the body was in that level of estrogen, but it declines. But then also you see there is a difference in the progesterone and estrogen. So there is a decline in estrogen that leads to the brain fog. But then if you see here, there's a difference between the progesterone and estrogen that leads to the mastalgia symptoms.
Okay. Thanks for explaining that, Rajshri. Yeah, you can continue.
And then this is another menopause journal article, which shows that there is difference between midlife aging and the menopause transition symptoms. The things that are written here in blue, it shows that these are symptoms of midlife aging, but the one in orange are the symptoms of menopause transition. So imagine coupling those two together. It is a stage in life where you need more help in dealing with your symptoms, as well as to understand if there is anything else going on, because this is also the time where other things also creep up, just like how Dr. Shobha, you said that there will be diabetes, there will be hypertension because of their change in lipid levels and the fat redistribution that happens because of the decline in estrogen. And then going on to polycystic ovarian syndrome, again, this is again, a multifactorial problem. Main thing is the insulin resistance and increase in the androgen levels, leading to a constellation of symptoms like irregular menstrual periods, infertility, weight gain. Weight gain mainly is because of the insulin resistance, acne, excess hair growth on the face and body, thinning scalp hair, skin tags, darkening skin, and poor sleep, depression or anxiety. It's about 7 to 10% of women in the childbearing age can have PCOS, and that's the main cause of infertility among women in that age group. So when you read all these studies, you can see that menopausal onset can vary by race and ethnicity. And there's also a familial component. The twin studies have suggested that there is heritability 30 to 85% of the time. And PCOS also runs in families. Lifestyle factors leading to later menopause include living in developing countries and urban areas. But that results that can cause earlier menopause is smoking, malnourishment, and lower socioeconomic status. You can have abnormal uterine bleeding with obesity, smoking, and stress. Endometrial cancer, higher in obesity, high-fat diet, and type 2 diabetes. When there is a higher level of body fat, adiposity, there is more vasomotor symptoms. And discordant family relationships can have, in that kind of situation as well. You can have irregular periods, constipation, and severity of perimenopausal symptoms. Women with PCOS can have type 2 diabetes, low levels of good cholesterol, high levels of bad cholesterol, and other body fats, including triglycerides, and they can increase the risk of heart attack and strokes. Also, there is a link between obesity and PCOS. This is one article which showed how lifestyle modification helps in reduction of their insulin resistance, better lipid metabolism, reduce inflammation, and help in hormonal balance, which I'll be talking more detail as we go along. So the main thing about lifestyle pillars and its principles are to eat whole food plant-based diet, whole food plant predominant diet is also great, because some of my patients, as I practice in Texas, and it's very hard for them to give up their meat or fish. So at least I recommend the plant predominant diet. Keep moving, sleeping well, being present, staying calm, and loving people is the main principles of lifestyle pillars. This is just a picture to show how beautiful the whole food plant-based diet looks like, with whole grains, plant proteins, fruits and vegetables, and herbs and spices. And water is the best beverage. So whole food plant-based diet for weight loss and metabolic optimization is also helps with improving menopausal symptoms and preventing and reversing common post-menopause related disease processes, as we had mentioned earlier, which is diabetes, hypertension, hypercholesterolemia. Plant-based phytoestrogens help also. Like, I also recommend my patients that if they are not allergic, they can try tofu, tempeh, miso, and soy milk unsweetened. It has higher affinity for beta receptors. So basically the one, there was a whole, because my patients say, okay, soy is now recommended or not. They say, because I try to explain to them there are two different receptors, and usually the phytoestrogens, the soy estrogens, they combine with the beta receptors, and that has no relation to breast cancer. Some of the plant-based proteins are edamame, again, lentils. I also talk about a lot of pumpkin seeds. Seeds and nuts are important in this time. And those women who eat more beans have lower risk of cardiovascular disease and type 2 diabetes. It can be protective against breast cancer. It lowers blood pressure, cholesterol, and reduces the inflammation. These are some of the foods that help. Again, like I talked earlier about seeds. Nut seeds are very important to be a part of diet in midlife women's health.
So we just got a question here, Rajashree. So like in menopause, if our estrogen levels are going down, so are these phytoestrogens helping us to get our levels of estrogen? So are they any similar to estrogen?
Yes, so they help with the symptoms of perimenopause and menopause.
Okay.
Especially hot flashes.
Mm-hmm.
As a physician, as an endocrinologist, I would also like to say, if women have no other risk factors during this age, hormone replacement therapy is very ideal. There was, earlier on, because of her study, there were a lot of propaganda against hormone replacement therapy, but hormone replacement therapy is the standard of care these days for symptoms of perimenopause, menopause.
Okay. Okay. I know we'll talk more about the hormone replacement therapy, but yeah.
Right. So, and then supplements wise, I do recommend vitamin D for bone health. And if they are completely plant-based, vitamin B12 is important.
Mm-hmm.
Oh, so I just want to point out some of these foods that are cooling, like especially cucumbers, kale, watermelon, mung beans, they all help as well. Definitely avoiding foods that are heat generating, especially a lot of caffeine, staying away from alcohol, staying away from refined flour, animal products, greasy foods and smoking. Stopping smoking or refraining from smoking helps. Some of the other lifestyle things that we can do are maintaining the adequate hydrations, like 2.7 liters of water in women, no more than 1 cup of caffeine, moderate exercise. Again, I'll talk more about activity, stress reducing techniques like mindfulness and meditation. Sleep hygiene is important. Again, whole food, plant-based food, no processed or food, white sugar or white flour, and having that positive relationship with food. And also some time to have self-care is important. I've read that, there should be, like, women is like how you said, Dr. Shobha, that women are the leaders in the household and they have a lot of responsibilities, and especially during midlife, they have so many things going on. Either their kids are going back to, going to college, they become empty nesters, or their kids are going to get married. They may be diagnosed with some of these chronic illnesses like diabetes, especially the women in midlife. And then they may be going through some bereavement because of loss of their parents. And then they may be going through some career changes, because it is the time that when they start developing or going higher in their career, and that leads to more stress. So there's always a lot of lists that women work with. So I've read that there should be a day in the women's life during this time, some few days, that there is a no list day, so that they just do not have to think about anything else. Their brain is clean, calm, and take time for self-care, socialize, meet with friends, just having that positive attitude, listening to your body needs, because stress is high, and keeping a routine also helps. And like I said before, that hydration and stress management techniques.
Mm-hmm. So SW is asking, how much vitamin D should we have each day?
So I understand that USPS Preventative Task Force, their requirements, and also American Family Practice, I think their requirements are lower. But as an endocrinologist, I recommend vitamin D3 2000 units daily.
So did you say 2000 units daily?
Yes, 2000 international units daily.
Daily, okay. And okay, so we just had another question. I have been experiencing a lot of acute hair loss in the past 3 days. What can I do to reverse it?
That's 3 days looks like a very, event that
Three years, past 3 years.
3 years. Okay.
Yeah.
So again, you need to understand what happened before that. Was there a lot of weight loss, or was there any surgeries that happened? And then, is there any iron deficiency? Is there any zinc deficiency? Just need to know a few things. And, we also check androgen levels. I don't know what the age of this person is, but yeah. So there's a lot of things to understand. Take history, what medicines have been tried before, and, what are the blood levels of certain, like thyroid test and all that. We want to know all that.
Okay. Okay. Thank you, Rajshree. Yeah, you can continue.
So yeah, this is just a slide to have a break, just like how you did a break. Your audience can go have some sage tea. I do have the sage tea. It tastes well, because sage is something that they have recommended for women in menopause, perimenopausal symptoms, vasomotor symptoms. I've tried that, feels good. Sometimes you can also have cooling teas like peppermint or mint tea with lemon squeezed. So this is the activity goal. So basically, you want to always give the patient or the woman who comes to me, I give like a SMART goal for activity. So it has to be specific, and how much they can do, what do they enjoy, and how much time they can do it, and what are they planning to do in the next 3 months before they come to see me. And it has to be very specific, time-bound, realistic, and measurable and attainable. This is the recommendation. Basically, 150 to 300 minutes of moderate intensity, or 750 to 150 minutes per week of vigorous intensity activity, muscle strengthening. is also important, 2 days a week. Like I said before, the goals have to be well written. They can do anything that they like. Some of the relaxation techniques, which I've tried, this alternate nostril breathing. I like it quite a lot. So I do that. Um,
Yeah, this alternate nostril breathing has a lot of research.
yes,
Like if we do it continuously, so even after 30 days, it has been shown that it really decreases our stress hormones, like whether it brings down the cortisol, and a lot of changes actually happen inside our bodies. We might be thinking it's just a simple technique, but it's really powerful. It really brings down our stress levels a lot.
yes. And then obviously with social connections and activity, you can always engage the whole family to do activity along with you. I have also tried, in my practice for myself, I have got these small weights from Amazon, and actually I use it, when I walk as well. Even when you're watching TV with the whole family, you can do a little bit without any equipment. You can do a few minutes of activity. And then again, sleep is very important. Using the bedroom for just sleeping, having that sleep hygiene, trying to cut off all devices, and just maybe reading a book or calming music, um, all leads to the good, and that, good environment for sleep. So 7 to 8 hours of sleep is what is recommended. Again, like how we said earlier, social connections is an important predictor of human happiness and long life. It has reduces blood pressure, improves heart rate, even take more care to quickly connect with people you see during the week, staying positive while connecting with others and sharing new experiences, spending time with others, and always being flexible, supportive, and being there for the other person helps, because again, like I said, women during this time go through a lot of things, and they don't, especially women, South Asian women, they don't want to open up about what they are going through. So it's just connecting with your friend and taking that time to be there, being supportive. So this patient, I had asked her about whole food plant-based diet, but she didn't want to give up her meat. So we were okay with the plant predominant diet. So she did change, gave up all her refined flours, saturated fats, sugars. So she also included strength and resistance training as well with sleep. We had referred her to the diabetes educator, gave her all these ACLM handouts. Um, she lost 15 pounds. Her A1C improved to 6.8%. So she's still continuing to follow similar plan forward diet. She still sees me. She's very happy to see me. So these are some of the handouts that I do say in my clinic, show the pictures. There's also a physicians committee for responsible medicine. There are some recipes there as well, free recipes. The Jumpstart program, and then how, some people say that they don't have time to cook, or that it takes, the produce section, like, that's very expensive. I do tell them about frozen food section, and also that it doesn't take as much, the time that they think it takes. It's very easy to make these nourish bowls or the smoothies. And then another important thing in post-menopause is the genitourinary syndrome. So we do talk about, dyspareunia. And then I've prescribed Premarin, the estrogen cream. Also talk about whole food plant-based diet, and Kegel's exercise is something that I bring up. Again, I think I've discussed all these handouts earlier on. A handout for polycystic ovarian syndrome. Again, the same whole food, plant-based diet, good sleep, managing stress. These are some of the shows that I asked them to watch on, if they have Netflix, Live to 100. And also there is the twin study by Chris Gardner, recently out. I've asked patients to watch them as well. And this is one of the books that I've used some of the content from. So that's the presentation that I have. Thank you so much.
Oh, thank you so much, Dr. Rajasree. So, like we have a few questions. Maybe I'll just start with the hormone replacement therapy. So, is it safe to have hormone replacement therapy? Because we hear a lot that it has a lot of risk factors. So, how safe is it to take the hormone replacement therapy?
So generally safe. We just need to find out if women had breast cancer, ovarian cancer, or if they have very uncontrolled blood pressure. So those are the things that we want, or pulmonary embolism, strokes. So we want to see if they don't have any of these contraindications. I have, they are usually very safe to take.
Okay. So, I mean, is it like dose dependent? So, let's say if we take a low dose of it is better versus than having a particular dose. Does that matter?
So hormone replacement therapy is usually a low dose estrogen progesterone. If the patient didn't have an uterus, we can give unopposed estrogen either as a patch or a pill. I generally like the patch because it avoids the first pass metabolism.
Mm-hmm.
But if you have uterus intact, then you do give like 12 days, 12 to 14 days of progesterone, micronized progesterone, or you can also give a continuous progesterone is also fine.
Okay.
And if there is any like what you call like bleeding, you just need to be investigated to look at the endometrial thickness.
Okay. Okay.
And then for people with breast cancer, once they have been treated and all that, if they have dyspareunia, you can still use localized Premarin cream.
Okay. Okay. So the other question we have, are there any particular tests that we need to get done in midlife? So, I mean, besides regular testing of our blood work, so are there particular tests that we need to be aware, especially during midlife?
Right. So perimenopause, menopause, these are all clinical. But I do understand where this question is coming from because I have so many patients who come say that, I have all these symptoms and I need to get my hormones checked. So if you ask me, do you comply? Yes, because the patients, but I know that this is clinical. If you have irregular periods, you are over 40 and no other cause found, your thyroid levels are fine. This could be perimenopause. And if you are menopause, there is no periods for a year, that is menopause. But, I do the FSH, estradiol, but, it's just for patient satisfaction.
Okay. But even like, are those tests beneficial, or could that test help us with anything? Like what
Mhm.
is the purpose of taking those tests?
So the only time, if the patient didn't have a uterus and
Mhm.
sometimes they have one ovary left, they have
Mhm.
these symptoms. So I want to know, like, is their ovary functioning or not? I do
Okay.
the test. So if
Uh-huh.
it is over 25, low estrogen, yes, now I can say that, you are in menopause.
Okay. Okay. So, okay, besides checking for hormones or checking for inflammation, heart health,
So
thyroid.
like
Yeah.
you said, during this time, like, every woman should go for their yearly checkup. And
Uh-huh.
then, there are certain guidelines, right, that we follow. After 40, you do your mammograms, 45 colonoscopy, like preventative care. And then
Mm-hmm.
you have to get your labs, like the A1C, if there's, A1C, thyroid,
Mm-hmm.
kidney and liver tests. So those are general tests that we get.
Mm-hmm. Mm-hmm. Excellent. Excellent. Um, any okay. Is there anything that we can do? So, because we know that like undergoing perimenopause or menopause is inevitable for a woman, but can we do something now so that like even before we come to the stage, before like we pass on to 50s or 60s, uh, are there any things that we can do now that would help us during perimenopause or menopause?
So I showed a slide earlier that people have more symptoms if they have more adiposity. So
Uh-huh.
trying to maintain their healthy weight uh,
Uh-huh.
by whole food, plant-based diet, activity,
Mhm.
doing that muscle strengthening,
Mhm.
resistance training,
Mhm.
and also mind work, like doing those mental exercises, stress management.
Okay, excellent. So, are there any natural ways to increase our estrogen levels without the hormone replacement therapy? Because as in perimenopause or menopause, we know that the levels are coming down. So, are there any natural ways to increase our estrogen levels since now our ovaries are not producing estrogen?
Right, right. I have looked at some of the papers and, there was one in 2023, I think. It was from Pakistan. I think they did some fenugreek. Fenugreek, there was some dose given in that and they tried and it had increased the estrogen. But, I usually don't, other than the usual herbs and spices that you add in food, I did not recommend any other supplements because at one point, these other things, because patients ask me about black cohosh, but they do increase the liver enzymes and there's some toxicity. So I don't usually, but recommend it. But I know patients take it.
Okay. Okay. So, any advice that you have for our listeners in terms of, I know like you have stressed how important it is for us to make a lifestyle change, right? Like if we are sleeping properly, if we are exercising properly, if we are eating plant-forward diet, that does take care of many things. So, like whether it is hot flashes or whether like the other symptoms that we are experiencing during menopause. So, like what would you tell our listeners like when it comes during perimenopause and also for people who are in menopause, um, like what are the things that they can do on a daily basis, or if you have simple tips um, that they can do to enhance their health, especially during at this level.
Right. So the most important thing is the positive relationship with themselves.
Mm.
Because you could have, don't depend on your partner to have that good relationship or anything. You need to develop a positive relationship with yourself. And then, always have that one person who you can call, right? Friends. And then doing like how you said, the diet, exercise, making an appointment with yourself so that you give yourself 1 hour to do your activities, the nostril, the alternate breathing or the stress management technique, or doing the activity resistance training. And obviously the whole day, and you are also the one who is teaching your family the good aspects of diet, right? So whole food, plant-based diet, the sleep hygiene, no devices at night, especially, with your children, you need to be, taking, that's what I do. I don't know if that's a good thing, but I do ask my daughter to give the phone to me when she goes to sleep, because otherwise they'll be just chatting overnight. So that's one thing. And I also want to tell you one thing about supplement post menopause. I do recommend vitamin D3.
Okay.
2000 units daily for their bone health, and
Mm-hmm.
doing calcium in their diet, like, the bok choy and, those
Mm-hmm.
calcium rich foods.
Mm-hmm. Excellent, excellent. So I'm just checking like if I have any other questions here. Um, okay, what about vitamin E? Do
Yeah.
we?
See, I have seen that paper, a paper that talked about vitamin E as well, but I did not practically. I have not recommended vitamin E.
Okay, so that's good. Yes. So I know you are such a busy doctor, busy mom, taking care of your children, and so well established in your profession, and you have to do so many things. So, like, how do you manage your day to day and keep your sanity?
So, in what way? Manage day to day? Because when I have a drive to come to work, so that's when I catch up with my relatives, my mom, uh,
Ah.
that I need to call. So that's the time. I also listen to some audible, some books that are uh, Girl, Wash Your Face is the recent book that I am doing audible on. Uh,
Uh-huh.
Something that we are led to believe several things that are being told or passed on to us from before, and we believe that that is truth, but it is not the case. So for your own improvement, you want to take away some of the beliefs so that you can self improve. That's the gist of the book. I think I haven't finished it yet.
Mhm.
And then I do try to make sure that I follow principles of this lifestyle pillar, whole food, plant-based diet. But if you to be honest, I have my daughter and my son, they do like their fish, so I do use some fish, salmon, but otherwise, after coming back from work, after dinner is when I do my activity, like walking and all that. It is very busy.
Mhm. Yes, yes, but yeah, I know for women, as you said, women wear many hats. They not only they have to take care of the workplace, they have to take care of the family, they have to take care of everything that goes inside the house, or even sometimes we are in that sandwich generation, like where we have to take care of our elders as well as we have to take care of the kids. So as you can see, like women has many role, and I'm glad you pointed out because you actually differentiated what are the symptoms because of the menopause and what are the symptoms that you can also experience because of aging,
Mhm.
because it's very important to differentiate, and so that we know and we can take care of it. So really, thank you. I know, like, you made some time during your busy day, and I know, like, again, you have to go back and um, again counsel your patients, and you have your appointments. So yeah, I wouldn't hold you for long, but really appreciate you taking the time and coming and increasing our awareness and inspiring us with all this. So thank you so much, Dr. Rajshri.
Thank you, Dr. Shobha, for this.
Thank you.